Hi there, I'm Dr. Jim with Vintage Heights Veterinary Hospital, and today I'm going to answer some common questions about dog allergies.
What kinds of allergies do dogs suffer from?
The most common type is what we call environmental, which is usually related to pollens or something in the environment that triggers an allergy. We can also have issues with food allergies where dogs might be sensitive to a protein like chicken or perhaps a grain like soybean. We can have what we call contact allergies where dogs might lay on something that's irritating like a burlap bag or a wool blanket, and that can happen to you or I. And then of course we have flea and tick related allergies because when fleas bite to get their blood meal, they inject a protein that the dog can become sensitive to, and then that will cause them to itch.
What aspects of my dog's health can be affected by allergies?
The primary way that dogs express their allergies, and cats too, it will primarily show up in the skin. And so usually what we'll see, irritated, inflamed ears, sometimes with a secondary infection. Sometimes they'll be licking and grooming or denuding the hair on their paws, in their groin. And when things really get going, dogs will sometimes chew on their thighs or on their front legs. And you'll kind of see this little moth-eaten hair loss. And so we tend to see that primarily in the spring and the fall with the onset of different types of pollens.
Can allergies in dogs cause behavioral changes?
Absolutely. Just think if you ran through a patch of poison ivy, how uncomfortable you would be. Sometimes when this happens in dogs, their skin literally feels like it's on fire. And so if your skin feels like it's on fire, are you going to be in a good mood? No, you're not. You're going to be, gosh, let's stop this. I just want to be left alone. My skin's burning, it's itching, I'm going to roll, I'm going to chew, I'm going to scratch, I'm going to do what I can to get relief. And so I might be a bit grumpy.
What are some common dog allergy triggers?
Like I say, in the spring and the fall, it's primarily pollens. And so in Nebraska, in our part of the woods, in the spring it's primarily trees and grasses. In the fall, it's grasses and weeds. And then we also have the harvest, which stirs up a lot of chaff, and that can blow in from multiple directions with the wind. In the fall, we can also have what we call flea allergy dermatitis because fleas are more prominent in the fall. They can be year-round, but that can be an issue. And sometimes dogs can have issues with their eyes as well. That's not as common, but like I say, the feet and the ears are usually the primary trigger points. As far as food allergies go, if dogs have that issue, they're going to show some gastrointestinal distress like vomiting or diarrhea. Sometimes it will show issues with irritated skin, especially the ears. And we tend to look at that especially during the winter months if the pollens are quiet and the dog has a history of winter allergies. That's something where we would think about a food allergy trial to try to rule that out.
What treatment options are there for dog allergy relief?
So there are different oral medications, and there's also an injection. The old standby is corticosteroids like prednisone or dexamethasone, things like that. Those have some side effects where they'll cause your dog to drink more, urinate more, and so forth. The advantage to them is that they're very inexpensive. Drawbacks though, it can cause panting, increased urination, increased water intake, increased food intake. Then there are the newer drugs like Apoquel, which most people have probably seen on TV with the talking pug. And it targets a specific chemical that trips off allergies in dogs. And there's a cousin to Apoquel, which is an injection called Cytopoint, and that also targets that specific chemical. And there's a new one out from Elanco called Zenrelia that we may end up using right now. We're kind of sitting back and seeing how it plays out. But it's supposed to be more potent than Apoquel, and so that may be a player down the road. Antihistamines in dogs are for very, very mild allergies. Antihistamines, as a rule, are generally not very effective. Histamine is not a big player in terms of allergies in dogs, and so for most dogs, those are not effective.
What is immunotherapy, and can it help my dog's allergies?
Immunotherapy involves an injection of what your dog is allergic to. So the dog would need to be tested. We would refer to a board-certified allergist for that. And they're going to do the skin test. And there's an art to that, so that's why we don't do that. There are tests where you can sample the saliva or the blood. We just have found that those are not as accurate. But let's say your dog on that skin test has an allergy to soybean. What they're going to do is take a soy extract, put it in an injection, and then they're going to inject that into the dog with gradually increasing amounts of soy. And the idea is that your dog gets used to it so that his immune system does not overreact. That's what an allergy is. It's an overreaction of the immune system to an innocuous substance like a pollen. So, if you have other questions, please give us a call at Vintage Heights Veterinary Hospital. Our phone number is 402-489-0501. I hope that was informative. Have a good day.